Singapore will reopen from Monday as planned after a month of virus restrictions. And this follows a drop in the number of COVID-19 cases and fewer clusters appearing. The country's task force says the reopening will be done in phases to make sure the virus is kept at bay. It has also thanked the public for its cooperation. Tan Se-hui with this report.
Aggressive testing, contact tracing and vaccination. That's how Singapore tamed its latest outbreak over the last month. This means it can now lift its restrictions and move out of the so-called Phase 2 heightened alert from Monday. But it's doing this in phases. To start off, group sizes for social gatherings will increase to 5, up from 2. Attractions, museums and libraries can increase capacities to 50%, twice the current number. Crowd sizes at cinemas, live shows and marriage solemnizations can also be as big as 250. But dining in at eateries will only resume from 21st June. That's also when gyms, fitness studios, tuition centres and spas can reopen. Meantime, work from home remains the default.
We managed to break the chain of transmission, I think, and control this wave of transmission without a painful circuit breaker. Instead, we use extensive ring fencing, contact tracing, using trace together, quarantine, extensive testing, localized lockdowns of malls, of schools, and vaccinations. And these are all capabilities that we have built over the last 1 year. So with all these capabilities, we really hope we have put circuit breaker as a response behind us. That means if there are any future outbreaks, we can use all these methods to control and break the chain of transmissions, as opposed to a very blanket approach.
Authorities say the gradual reopening is because some activities where people remove their mask are more risky. It includes dining in, exercising at gyms, or going for a facial. So these will have to wait a week longer. But the authorities say the country is not completely out of the woods. They need to see a 7-day average trend go down. Now that means there needs to be a wait of one full incubation cycle of 14 days from when a low number of cases are recorded.
As we saw the drop in the number of community cases occurring last week after the 5th of June, the next 1 week is important to confirm our assessment. While the situation continues to improve, the fact that we see occasional unlinked cases in the community indicates that cryptic spread of infection in the community has been suppressed but has not been eradicated. If we drop our guard, be complacent, lose our discipline in practicing mask wearing, and stop adhering to safe management measures as we lighten up on Phase 2 heightened alert measures, more unlinked cases can easily arise.
The COVID task force says border restrictions will be eased once vaccination rates are higher and the local situation becomes more stable. But the focus now is to ensure the community can resume more activities safely.